I work with the Health Service Executive. I'm on the Directorate, and as you saw from Ivan's question earlier, there's a very significant resource provided by the HSE to the Community and Voluntary pillar. So what I wanted to do was just touch on a few aspects of that in the context of our theme here this morning. And maybe just the first is to talk about the funding framework, if you like, that idea of governance, accountability and funding framework. So what is that? I suppose fundamentally, as a statutory provider, a bit like Fred on the childcare side, we're based on statute. So the relationship that governs our funding of the voluntary sector is based in legislation, the Health Act, and that sets out the legal framework within which we operate and the basis upon which we can fund. That's controlled by the Oireachtas, and we're accountable to the Oireachtas through the Department of Health. And we attended the Public Accounts Committee and so on, and the whole idea of service arrangements was the agreed mechanism with the state to actually oversee that funding arrangement. And so we've been working on the development of that. One of the key pieces that has been a challenge in recent years has been trying to link the funding we're providing with activity and outputs, costs, quality and outcomes. We probably focus a lot on activity. We need to move more into the space of quality and outcomes. But there's been a lot of work done on that, a lot of really good work and collaborative work, and I think it stands to ourselves and the sector within the HSE that for the first time this year, in March of this year, all the service arrangements were signed and agreed, and difficult negotiation around all of that, but a very positive outcome for us, and one that's very beneficial from a HSE point of view in talking to colleagues of Orla in the Department of Public Expenditure who ultimately allocate the resource to health. I'm going to play with two words here, service and community, because one part of what we deliver is service. So we deliver 10.5 million hours of home health, about 300 million worth of home care, we provide nearly 9,000 residential places to people with intellectual disability or people with physical and sensory disability. And so these are actual deliverables that we have to provide for. And there's a kind of a cost effectiveness and a service arrangement component to that, or a contracting component. But the other side of that coin is that people don't live in care groups like older people or disability, they live in communities. And if we want vibrant and effective communities, we need to support those and enable those communities to work with us. And that's, I think, in Ireland where the community and voluntary sector has come in. And in my experience and in the HSE, we are trying to work on a community development approach and that idea of building collaborative partnerships. And obviously we have to have regard to regulators, whether it's HICWA or whether it's the charity regulator now, and that sets part of the context, I think. Moving on then to an important issue, and I saw it, in the report you've produced and in a lot of the work that's been going on, led by the Department of Public Expenditure here, in relation to this whole issue of funding the voluntary sector and engagement with the voluntary sector. Values is a very fundamental part of that. And so the 4 values at the bottom, care, compassion, trust and learning, they're the values that the HSE espouses to live by. And we have been working very hard on that. It's easy to put those up, but do you actually live those organisationally every day? How do you engage with others around that? And we held a healthcare leader convention, a conference, the DG runs one every year, and this year the focus was on values and on these values. And international experience shows that the more you can actually live the values in an organisation, the more empowering that organisation can be to work in and to support and engage with others. For me then, above that is 2 words, service and community. And those have been significant, I think, and are very relevant to the current piece. Just as I was talking, I'm a public servant. Many of you are public servants, and we serve communities, we serve people, and that's our purpose, and that's why we are resourced and so on. But equally, we have services to deliver, as I've just been saying. But the other side of that is we need to have sustainable communities, and people live in community, and you need to have a community that can be sustained to support their own people. So for me, in all the years I've worked in the public service, that issue of enabling local communities to support their own people is fundamental. So it is the issue of the old word of community. That's what it's about. But we are in a position where we have to make that real. There are services that have to be delivered, but we also have to do that in a responsive and effective way. We have to be accountable for it, but we also have to make sure that we're supporting those communities so that they're sustained over time. To me then, up at the top there in the slide, values, if we get the values piece right, that will actually drive the sustainable models of service that we need, and it will also deliver value. It will deliver value in terms of cost effectiveness, but will also deliver value in the sense of what Ivan was talking about earlier in relation to societal value. And that's a really important piece, I think, that we need to get right. And what I'm suggesting there is that we need to develop shared values, and we need to develop a platform and use that as the platform to sustain the kind of collaborative engagement that we need to have between ourselves as we move ahead over time. This one then, structure. All of us who work or leadership or management in the public service or anywhere really know that it's really about relationship and people. Structure gives you maybe 20% of what you need, but it is also important, and we are embarking on a significant reform in the organisational structures of the community side in the HSE with these 9 community healthcare organisations, and I'm sure many of you are well aware of that. But for me, this piece of it, and why I'm talking about it today, is just that this piece of it is very relevant. 9 community healthcare organisations, but 19 networks. So networks of, on average, 50,000 population, ranging from 30 to 70, and where for the first time one person will be responsible for the delivery of primary care services there, and linking and integrating other services, including linking with the voluntary sector partners at a local level. It provides for integration, it provides for devolution of greater responsibility and decision making to local level, to those who know and are engaged with the people in the community. But it also enables us to start an effective linking, not just between primary and secondary care like hospitals, but between the health service and other government departments, whether it is housing, whether it is social protection, education, the guards, the local GAA, the local rugby club, that type of informal networking and connecting, and the idea of community connectors, where not only are you driving that from a health service point of view, but you're linking with the rest and enabling people to engage across the sector. And I think that's one of the greatest strengths that the voluntary sector brings, that white space between the different services and joining things up for people on the ground. And it's one of the great strengths, but it's one that we have to build on in a current context. I think a really important point is to develop consultative fora. So for us, we want to develop consultative fora at national, at CHO, and at the network level, so that there's an engagement between ourselves and other services, other government departments, but also the community and voluntary sector. I think as well, it's really important that this idea of integration, I think it's at this network level that integration can really happen, and that where you can actually translate this issue of values in a meaningful way at a local level. And I think that this opportunity offers a lot to us, I think, as we roll out the new community healthcare organisations. For me, the issue of outcomes has been mentioned, and it's important to talk about that. So when I took up my role a couple of years ago as a National Director of Social Care, I set myself these goals in terms of achieving outcomes at the end of my time. And I suppose all of us who are involved, whether we're public servants in government departments and health service executive or wherever, or yourselves in the community and voluntary sector, we do what we do to make a difference to people. That's really what makes us tick. And I think for us, this is an important focus. Other speakers have talked about it, and it's about making this issue of outcomes real. So for me, a really important piece that those that we serve are saying to us is that they find it complicated to engage with us at all levels in the system. And so we need to do something about information and how we communicate with them, so appropriate information and advice to support people to make decisions for themselves and to enable them. I think point 3 and 5 there are really important for the discussion we're having with yourselves about maximising the potential for local communities and those social networks to sustain people in their own communities, but also that service users and local communities are heard and involved in the design of service, in the implementation of those services, and that there's a real dialogue happens in that. Where we engage most effectively as a system, I think that works well, but we don't do it well enough, consistently enough across the country, and there's work for both you and us in that to make that happen. I think another important piece is that last point. People, whether we like it or not, want choice. They want options. And they see those options in the public, the private and the voluntary sector. And for us, it's about ensuring, for me, there's a really important point from a public service point of view. We must ensure that we organise ourselves in a way which makes sure that the most vulnerable, the old, the disabled, who are the highest dependent, that they will always have access to the services they need. And you have to be careful about how you design funding and service models then that you ensure that that happens and you don't end up always as a price taker. At the same time, money is scarce and you need to maximise the use of your existing resource if you're making a case to people in Deeper and elsewhere to look for more. So then, that's a quick run through sort of the canvas as I see it, but then maybe to talk about challenges and opportunities. So when you take that issue of the resources and so on, this service and community, two sides of the same coin, how do we ensure that we maximise the delivery of services using not just public, private, but also the voluntary sector as providers, but how do we make sure that the other side of the coin about that community component of support and networks and additional advocacy and other aspects that are really beneficial, how do you ensure that that is also maintained in a way that works? So from the service point of view, we will be focusing and we are working with the sector in relation to linking funding to activity and outputs, cost, quality and outcomes. And we use service arrangements to do that, and that is going to be a continuing theme. And it is going to be a requirement for us to demonstrate that, say for me, the €3 billion that I have responsibility for in social care, or the €5 billion that myself and 3 other colleagues have responsibility for in the community, is actually delivering the type of services that we're saying that it's to deliver. On the other side of it, we must ensure that there's a process of collaboration and partnership at both national, in our world CHO, and at network level that engages and works between the voluntary sector and the HSE in this case, or the state overall. And I think that's the kind of work we've been engaged with Ivan and colleagues in the Wheel and in other voluntary organisations to see how do we make that happen. An issue for me around funding and the organisations, one of the key pieces for me is sustainability. If we keep operating in the way we are today, it isn't a sustainable model. But that's not to say, for me, I want to ensure that we build a model that is sustainable, that supports a very strong and vibrant voluntary sector that meets the needs of those local communities. And it's from the ground up, because one of the strengths of the voluntary sector is that it has that engagement at a local level, it has trust, it has participation, which is really very valuable. But we also have to ensure that we have sustainable models. And if you look at us, we have in the HSE 3,000 organisations that we have contracts or service arrangements with. There's 1,500 in social care. It seems to me that there's a capacity to develop shared service platforms there that would eliminate the necessity for the range of HR and finance and back office and other work that can be done more effectively without losing the independence and the autonomy at the local level that all of you want to be focused on in engaging with communities, and we have to work on that. I believe that collaborative partnerships are the way forward. We are doing that with a number of the organisations. We have a major merger coming on in the Kildare-Wicklow area. We've already done some of that, but it's done in partnership and collaboration with the sector, and I think that's an important piece. There is also a piece about building capacity. So there must be capacity built within communities and within the HSE. Things like ICT, if we are going to have individualised budgeting, if we are going to have different funding models and resource allocation models, we need to have proper finance systems, HR systems and so on. And those are being resourced. We're doing a lot of work with Health and Deeper in relation to that. But that's also something that we'll have to engage with yourselves as a sector in a more proactive way. I think also that issue I'm mentioning there of public-private voluntary mix, that's an issue that comes up regularly. We're certainly supporters of that mix, and that includes a strong and vibrant voluntary sector that can meet regulatory requirements but also can support their local communities. The issue of choice becomes important for that, because as we provide more choice to individuals, they will choose where they want to spend their money. This idea of individualised budgeting, we receive far greater requests now from people. They say, you know, what are you paying for me? What are you giving that organisation for me? How much money do they get? What are they supposed to be delivering for me? So the service user is interested in that and wants to have a say in that. And I think that's something that as providers or as community sector advocates and community development type of approach, we need to be aware of and work on to develop a sustainable model that works for the system. I think that last piece on the community side there, last point I was making of building a coalition of support. I think in this endeavour, it's important that the type of consultation that Deeper and Orla have undertaken happens. And I think in any significant change that I've ever been involved in, a really important part of it is building that coalition of support between local communities, voluntary partners, staff and unions who get impacted by what we do, the political system as well, so that you get a shared objective, you have shared goals, and you work to implement them over an agreed period of time. And one of the things we have to do then, and will be a requirement, at a time of difficult resourcing, is to be able to provide evidence that demonstrates what we're doing and that we are actually delivering the most effective services that we can, that we're doing the best that we can do at any particular point. I think that's all that can be asked of us. This issue of regulation is also important. The charity regulator is coming later, I understand, to engage with you. That's a new part of this. We have established a head of compliance to assist us in the HSE, and many of you have met Brian Purcell and his team, and we will be working with the charity regulator in relation to his role. But we also have regulators like HICWA, we have regulators like the Mental Health Commission and others. And there's a requirement for us and challenges for the sector and for the HSE to work with voluntary providers to ensure that they can meet and are fit for purpose to meet the challenge of regulation. And that's an important piece, and there are resources associated with that. There's capability building, but there's also, if you bring up standards as a state and if you decide that you're going to improve standards and regulate that, you need to provide the resources and be aware of that. So this idea of impact assessment is important. We've learned that. And I think it's important, again, if we're doing that we have a proper evidence base to do it. So my message fundamentally to you is that it's one of support, it's one of collaboration and participation with you to address these challenges before us and to do it in a way that works principally for yourselves and the HSE and the state, but most important for local communities and the people that we serve. Thank you.
Pat.